So I work for Merck Sharp and Dohme, or MSD Australia. They're a global pharmaceutical company, and my title is Hospital Specialty Representative. So I work for, in the current scope of my current job is essentially educating healthcare professionals. So for me specifically, it's specialists, so specialists in my field, which is type 2 diabetes. That's the scope of my role. So a typical day, there often is no truly typical day in this role. Which is quite a nice thing actually. It's quite a varied job. So I suppose the basic thing that we do, or that I do is essentially gaining appointments and getting requests actually also from specialists in a region, in like my geographical region, which is Brisbane North. And essentially, being kind of a conduit between the actual medications and the science behind them, and then and then tailoring that to how it can benefit a patient, or like a specialist patient. That's kind of the day-to-day. You usually have a number that you have to see, like the amount of people that you've got to see in a day, obviously, because you got to be pretty self-motivated and get out there yourself and see these people. Obviously you have support and that too from managers and peers and that type of thing. And then another kind of aspect of the role is around actual specific educational events. So pharmaceutical companies, as most can imagine, have a decent amount of money as far as funding research and also funding like peer-to-peer medical education events. So basically something like that can be usually happening after hours, I'd say usually after clinic hours, where you organise, say, a group of GPs or specialists or allied healthcare professionals like pharmacists, nurses, to come together and actually hear medical education from an expert in the field. So that's definitely a different part. That's not an everyday thing, but it really does mix it up and kind of in between the day-to-day of actually just seeing customers. So for me, something that I wasn't getting from, say, a typical pharmacy or pharmacist kind of role was just being able to travel, to be able to travel around Australia internationally, and also just travel away from the desk. So, standing in the one spot all day in a pharmacy traditionally, after doing it throughout uni and throughout my time, working in pharmacy after uni briefly, I just decided for me personally that that travel and being autonomous and not being bound by a desk was a great thing for me. And so that is honestly probably what I love most. I also, other than that, you do get a real sense of satisfaction because you have really personal relationships with your customers or specialists, and so you do gain a lot of personal satisfaction, and also it really ignites kind of the clinical side of what you did in your degree, so you can go really in depth to to things. So that's, I say, my personal, the best thing about it anyway, that I enjoy. There's many. I think first and foremost, and those studying will know, your clinical knowledge has to be quite good, and in a specific area. That's what's quite nice. Whereas studying pharmacy, you've got to know a little bit about a lot of things, but you actually have the capability to go really in depth to a specific clinical area. So clinical knowledge and being across that is really important. Another thing would be you've got to be a bit of a self-starter, so you have to really know that you're the type of person that when you wake up in the morning, that if you've got to go out and work, essentially, no one's going to be there knocking on your door, or no one's going to be watching their clock to say like, oh, your shift is about to begin. That's a really important thing, to be self-motivated. And then, the other thing is really important is having good conversational skills and people skills. It is important for pharmacy too, absolutely, but it is definitely more of a role where you can get away with being more of a clinician and not having to have as strong people skills. But working in the pharmaceutical industry, you really need to be able to deal with people effectively, because you're speaking to people all day, whether it's over the phone, whether it's via email. and obviously face-to-face too. So yeah, they're probably, you know, the three key things I can think of that yeah, you'd need for a job like this. One of the most challenging aspects of my role is often, you know, no matter what disease state you're working in or what medications you're representing, I suppose, from the company, sometimes the most challenging thing is dealing with your customers and actually finding a place amongst the noise, I suppose, because there are so many options in most disease states. It's rare that, you know, unless you're talking about specific cancers or specific, you know, really specific diseases, there are often a lot of options for clinicians to decide on. So yeah, one of the most challenging things is taking into account what you know and what you've learnt from a company, which is from one aspect of their point of view essentially, and then being able to take into account everything else that exists in the real world and the choices that people make, and but then also being able to convey that, you know, appropriately, and also find those times where win wouldn't be the right word, but you can convince somebody, you know, that maybe, you know, they should be using a product from your company and supporting them in that way. So yeah, in this role, yeah, a big challenge also as far as dealing with an industry, being in the pharmaceutical industry, is when you learn from them and when you hear from them, it's all coming from the company. So, you know, they have their own kind of interests, I suppose, as far as the success of a product. And so do you, of course, working for that company. But a big kind of ethical challenge, I suppose, is when you're dealing with customers, so specialists in my case, and sometimes the other medications that are out there in the world and available for a disease state is a more appropriate choice. And so I suppose coming from a degree and coming from, you know, pharmacy and the pharmacy side of things, very ethical and balanced, and that really is a challenge obviously in your actual interaction, but it's also a challenge internally that you kind of have to deal with too. So I think as long as you work for a company that supports that and supports ethical medicine, and they all do vary in their approaches. Luckily, Merck Sharp & Dohme are extremely ethical in that way and the way they operate. But yeah, that's absolutely a challenge. You're kind of navigating that and knowing that at the end of the day, the most important thing is the patient, and the patient being treated with the correct medicine for them. So, and if it happens to be your own product that you're representing, great. If it isn't, then it isn't. You know, there's other patients out there. So yeah, so that'll be the challenging thing for me. So yeah, going right back, yeah, my initial interest in healthcare and helping other people came from my sister was quite ill when I was young. She had leukemia, and I'd always vowed that I'd, you know, become a doctor and cure cancer. And as I kind of went through high school, I kind of realised that yeah, maybe, you know, pharmacy was something for me, because I actually preferred, I think, the medication side of thing rather than the actual hands-on, you know, performing surgery on patients, that type of thing. It didn't actually appeal to me as much as I thought it did. So yeah, I embarked on a Bachelor of Pharmaceutical Science degree at Griffith University, with, at the time, full intentions of finishing but registering as a pharmacist by the end. It was kind of probably about the midway point of the degree that I had worked in pharmacy nearly from the beginning. So I was working as a pharmacy assistant and then also a dispensary technician. So I was qualified to work in the dispensary. So I kind of was doing almost the role of a pharmacist without the legal liability, I suppose, of actually being a pharmacist and you know, giving medications to people. So I got a really good taste. I was really lucky to do that and get a really good taste while I was at uni. And throughout that, I kind of realised I wasn't sure if the whole 9 to 5, working Saturdays, you know, that type of thing was for me. Saturdays and Sundays it was. And so yeah, I decided then to kind of broaden my horizons. We got visits in the pharmacy, as I'm sure pharmacy students working in pharmacy still do, get visits from representatives from different companies, and it was just yeah, an odd coincidence that I wanted to speak to a rep and learn a bit about what they do. And I luckily met a great one who was really forthcoming and let me go out on the road with them and learn about the role. And yeah, that, because in a typical pharmacy degree, it isn't a typical career choice, I suppose, or career progression. When you study pharmacy, you invariably become a pharmacist. So yeah, that kind of gave me an interest in industry. So yeah, I finished my degree. I continued to work in community pharmacy. I also worked in hospital pharmacy. So I worked at a private hospital here in Brisbane. And working in that, I think for about 6 months post my degree, it solidified that maybe it wasn't for me. And so that's when I pursued, going down the pharmaceutical industry route to give it a go properly and see how it worked for me. For me, working in pharmacy or a traditional pharmacy and a 9-to-5 kind of job just wasn't for me as far as feeling good in a job. I did really love the patient elements and directly dealing with patients, but overall I kind of wanted to travel, wanted to be in that big company and broaden my horizons a little bit, and so that's why I veered towards a global pharmaceutical company. It definitely differs as far as working, in a typical pharmacy environment. You do know about specific areas, specific disease states really in depth by comparison. So knowing your pharmacology about the pharmacology of different medications is much more pronounced, whereas a typical pharmacist is more patient focused and that type of thing rather than the actual pharmacology of medications. That's that large difference there, and for me, that's why I chose it. The chance to travel, around Australia and internationally, and work in an organisation with career progression too, with other opportunities in totally different spaces to what I'm even currently in now. Whereas pharmacy's pretty much a one track. Once you're qualified, sure you can work in different places, but you're always a pharmacist. Whereas working in industry, you can nearly be anything. You can work in medical, marketing, regulatory affairs. There's just so many divisions of a pharmaceutical company, and to me that's what made the decision easier, and it's where I realised I wanted to be. So I initially studied a Bachelor of Pharmaceutical Science at Griffith Uni, and that equipped, at the time anyway, that equips you for different avenues right then and there. So you could obviously do a Master of Pharmacy at the time and then qualify as a pharmacist, or you could change tack totally and kind of go down any healthcare kind of route. So with that degree, I suppose it did give me a real advantage when it came to interviewing for roles like the one I currently have. You're extremely highly regarded when you've come from a clinical background, especially these days. I think sometimes pharmaceutical companies still in the community even have a perception of what they were 10, 15 years ago, and it isn't that way anymore, and it's a good thing that it isn't. It's a really clinical environment and a clinical workplace, and being at the top of your game clinically is a massive part of it, and coming from pharmacy, it really gives you that advantage, or having that background gives you the advantage as far as understanding the marketplace and understanding medications already, and probably even having exposure to medications in the real patient scenarios beforehand, rather than just knowing the data and the science. So it really gives you a well-rounded, it makes you a really well-rounded candidate for a role like this. As far as on the job, the great thing about working for a big company is that they do really value their people and really want to continually educate them and give them opportunities to grow within the organisation. So one thing that I do have is a Medicines Australia qualification. So they're the governing body of all pharmaceutical companies, and a code of conduct that exists that all have to abide by that are in Australia. So I'm qualified in that, so that's quite a good thing, and it allows you then to conduct yourself in an ethical way, in a way that by the government and industry it's an approved way, I suppose. So you're not exerting undue influence or doing the wrong things as far as dealing with healthcare professionals. So straight out of uni, I can understand especially when starting uni, you may not have an idea of where you want to end up when you finish, and I certainly didn't, or it changed along the way. After getting my degree, I knew that was important, so sticking it out and having my degree, and then post that, I did then begin in pharmacy, or start working in actual pharmacy, which is just what my degree was, because I hadn't decided over that time where I wanted to be or where I wanted to stay. And then and then post that is when I started actively, a little bit on a whim, but also because I'd had the experience earlier where I'd actually gone out into the field with a representative and actually saw what they did. That was a really key thing, I think, for me. I didn't know anyone in the industry already, and that really gave me a taste of the industry. So if it is something you think you might be interested in, you'll often find people in the industry are more than forthcoming to do that, and to I suppose showcase what they do. So that really helped. And then post that, applying for jobs, I suppose, and applying for jobs in the pharmaceutical industry. It's quite an art, and like all job applications are, depending where you want to be. But specifically with the pharmaceutical industry, they are very focused on achievement, and we're focused on achievement. So as far as me what really helped was working with a few different recruiters. So like a lot of industries, there are recruiters, and there are definitely ones in the pharmaceutical industry, and it's really important to find a recruiter that believes in you and your ability, and also then is willing to assist you, with upskilling yourself, because submitting a resume to a pharmaceutical company is not going to be enough to secure a role. So it really is about highlighting achievement and highlighting how you stand out, basically, from other graduates, because unfortunately a degree just isn't enough. You need to have other skills and other attributes and be able to convey that about yourself. So there was that process, and then luckily for me, one of the first pharmaceutical companies I'd actually interviewed for, I got the role. I think would have liked to know about how the pharmaceutical company and how they actually operate today, and how clinically minded they are, and how they actually function and operate, and also as far as pharmacology, clinical knowledge, all of that really combines into roles today, no matter what you're doing in the business. And if I'd known that, I suppose back then, it would have been great, because it would have allowed me to set my sight on it sooner, and been able to either get there a tad faster, or just be more focused while I was studying, when you know what the end goal is. Also, another thing would be, as far as these companies, in contrast to a pharmacy in a local area, companies in the pharmaceutical industry are global companies. So if you've got aspirations to work anywhere around the world, you're going to be able to get there, with a pharmaceutical company. And I really would have loved to know that too, because I know that for me anyway, travelling overseas is a really big part of my life, and I wanted it to be, and the fact that I could be working and travelling and living in another country at the same time is fantastic. So advice from me would be to, no matter what degree you're in, or where you've started, or what you think you might be doing at the end of a degree, or whether you've even got an idea, just be open along the way. Know that often it is always not just what you know, it is who you know too. So, expand those horizons and find the people. If you don't already have the contacts like I didn't, find people that might be willing to give you a bit of their time to learn, and to actually be as hands-on as you possibly can in different roles and in different kind of avenues within pharmacy and the pharmaceutical industry. I think that's probably a big piece of advice, and also try and think as much as you possibly can about you and who you are, and whether what you've decided to start studying is going to suit you and your personal preferences just as a human being. I think that was, for me, that's part of the reason why I changed it. I didn't want to be standing in the one place all day, and it's such a tiny thing, but it is such a big part of any job, that we go into, is your environment, and being comfortable in that, and being able to thrive in it. So really try and look within yourself, even if you don't have any idea of what you want to be at the end. Just try and know who you are, and then find something to match that along the way.